So when it comes from a patient standpoint, the main thing that you need to know is what is the antibody drug conjugate that I'm getting, or what's the name of the antibody drug conjugate, and what are the side effects that are associated with the antibody drug conjugates. So as I mentioned, the side effects from the antibody drug conjugates will be usually generally less than the side effects from chemotherapy because it's going to particularly affect a particular cell with that antigen or with that particular agent. However, it can also have several side effects. For example, there are several antibody drug conjugates that we use in breast cancer, and one of them is TDM1 or trastuzumab emtansine. So in this TDM1, it is particularly designed to attach to a particular target in the breast cancer called as HER2. But still the problem that happens is it's not just in the breast. There are several other organ systems or several other organs in our body which has that particular antigen HER2. So when it attached to that particular target HER2 in the breast cancer, it can also go and attach to the HER2 that is expressed in lungs or in your eye or in your hair, or like wherever that HER2 is seen, it can go and attach to that particular HER2 agent. And then it can also cause some side effects to that particular organ. So you need to know what are the side effects of antibody drug conjugates. One of the most common side effects of antibody drug conjugate that we hear is mucositis or inflammation of the mucosa inside the mouth and also in your stomach lining. And this is particularly seen in one of the antibodies that we mentioned, Dato-DXd. Some of the antibody drug conjugates can cause alopecia or hair loss. And some antibody conjugates can cause rash in your body. Some of the antibody drug conjugates can cause liver toxicity, or it can affect your liver, which turns to have some abnormalities in the liver function. Some antibody drug conjugates can cause diarrhea. Some of them causes hematological toxicities, which means it can affect the blood cells in your body and it can lead to decreased counts of blood cells in your body. Some other antibodies affects eyes, which leads to several problems in the eyes. And some of the antibodies causes problems to the lungs, and we call it as interstitial lung disease, which we will discuss in the future slides. And some antibody drug conjugates, especially TDM1 or trastuzumab emtansine or TDXT, these can affect the heart because it is mainly HER2 targeted agents, or it's mainly going to target the particular antigen HER2. So it can cause to cardiac toxicities, including heart failure. And most of the antibody conjugates, they can cause nausea or vomiting, especially TDXT or trastuzumab deruxtecan or sacituzumab govitecan, which we mentioned in the prior slide, or Dato-DXd. And you need to be very careful with the antibody drug conjugate, especially if you are in the reproductive age group and if you're planning for a pregnancy, because all the antibody drug conjugates, they can cause toxicity to the fetus. So it's not recommended for an antibody drug conjugate to be given in a pregnant patient or if someone who is planning to have pregnancy in the very near future. And some of these antibody drug conjugates can affect our nervous system and can lead to what we call as peripheral neuropathy, which usually presents with tingling and numbness of the fingers or toes. So these are the most common, or some of them are like serious side effects as well. But these are the side effects that we usually see with antibody drug conjugates.